everyone, today I'd like to shine a spotlight on canine cognitive dysfunction or CCD, as it's often not recognised in veterinary practice. This may be because clients assume that the signs of CCD are just signs of normal ageing, or because some of the clinical signs of CCD, canine cognitive dysfunction, overlap with those of other diseases associated with ageing. CCD is the canine equivalent of human Alzheimer's disease. Many of us, unfortunately, are familiar with Alzheimer's as family members have suffered from it. Indeed, both my grandmothers developed Alzheimer's disease towards the end of their lives, and it was very hard to watch. The features of CCD are actually so similar to Alzheimer's disease that it is often studied to understand human Alzheimer's better. The pathological features of CCD include vascular damage, the deposition of an abnormal protein called amyloid, and altered neurotransmitter levels in the brain. So what are the clinical signs of CCD and how do they overlap with other diseases that are associated with ageing? So these signs have been understood for a good while now, at least informally by veterinary behaviourists and clinicians such as Gary Landsberg, but the signs that we could identify in dogs with CCD include disorientation, so things like wandering, getting lost in familiar environments. A common one is trying to pass through the hinge side of a door rather than the side that opens, or trying to pass through narrow spaces or kind of standing in the way of narrow spaces, as well as difficulty locating dropped food. Now that could just be put down to sensory deterioration such as reduced sight or reduced hearing. In terms of social interaction, the animal may be less active than normal and may make less contact with family members. But again, that could be put down to the animal slowing down or getting older, and it certainly decreases in play behaviour. People would often put that down to just the animal getting older and not being as playful and puppy-like as before. They may not recognise familiar individuals either that they would have recognised before and known well. In terms of sleep-wake cycle, dogs may be more active at night, but again, if they also have another disease such as chronic kidney disease or liver disease that causes polyuria and polydipsia, and they may need to go to the toilet frequently, restlessness at night might be attributed to that, or it might be suspected that it's that rather than a behavioural issue. House soiling is also a feature, such as toileting in inappropriate places when the dog was previously house trained. But again, that can overlap or throw suspicion on things like, especially in bitches, incontinence, urinary incontinence, or again, if the animal is polyuric, polydipsic, do they have a chronic condition like kidney or liver disease, for example, or potentially a hormonal one, if they're urinating in the house, or it could be put down to if they're defecating in the house, do they have a gastrointestinal issue going on? In terms of activity, there can be pacing or wandering, and they can also have anxiety, especially in new environments and in the veterinary clinic. But most dogs can be at least a little bit anxious in the veterinary context, so we don't really find that surprising. In fact, CCD is very common in dogs and its prevalence increases with age. A questionnaire-based study in the US by McQuitty et al. Found that the prevalence of CCD in 11 to 12-year-old dogs was 18.8%. In 13 to 14-year-old dogs, it rose to 45.3%. In 15 to 16-year-olds, it was 67.3%. And in dogs aged 17 years of age or older, it was a whopping 80%. So it's not surprising that I suspect that my dog Daisy, who's 16 and a half years old, has it. So I'd like to explore CCD through a combined personal and professional lens and report my findings to you as I go along. Let me tell you a little about my dog Daisy, or Days for short, that's what we tend to call her, and that's her there in the picture. She is a tiny little terrier crossbreed dog. We think that she is part Cairn Terrier and part miniature Yorkie, and we've had her since she was 8 or 10 weeks old, and so small she could fit into the palm of a hand. And at 4.5 kilograms now, she's a bit bigger, more like cat-sized rather than rodent-sized. And she's still often mistaken for a puppy, especially after she gets groomed. She is a great companion. very good with people, including children, and not too bad with other dogs, so long as they don't jump on top of her. She's also feisty and very much knows her mind. She loves walks, food, scavenging, unfortunately, and training. And she used to love squeaky toys and tug toys, but not anymore. She won't play with those with me anymore. Daisy has had chronic pancreatitis for the last few years, and we manage this with a low-fat diet. But she does vomit occasionally from time to time. She also has osteoarthritis in her back legs, which we are treating with an NSAID, non-steroidal anti-inflammatory drug, orally every day. And her sight and hearing are quite poor now as well. I started to notice some behaviour changes about 6 months ago, especially house soiling. She used to do that a little bit before because we trained her on puppy training pads, and she sort of recognised the back door mat as an occasional toilet if it's raining and she didn't want to go out. But it really had increased and started happening in sort of different locations and not just on the mat. And we, what we do is we just keep washing the mats and rotating it, but it's become a lot more frequent. And we've come to suspect that she might have canine cognitive dysfunction, although the changes probably have been happening slowly and subtly over time. So please follow along with me, as I'm going to use a couple of canine cognitive dysfunction scales from the literature to try to find out whether she has it or not. And hopefully that'll be helpful to you too. So first up is an older and perhaps original canine cognitive dysfunction scale. It's called the Canine Cognitive Dysfunction Rating Scale, which makes sense, or the CCD, or for short, because that's quite a mouthful. It's one of the first, if not the actual first, I'm not entirely sure, formal and validated scale for canine cognitive dysfunction. So apart from just those clinical signs observed subjectively or objectively by a veterinary practitioner or a veterinary behaviourist. So it's better for screening for the presence or absence of CCD, I'm told, rather than identifying different levels of severity. It contains 13 different items or questions clustered into different categories on orientation, memory, and apathy or interaction, impaired olfaction and locomotion. And each question or item is rated 1 to 5 based on the frequency of its appearance or the severity, for the most part, except for one particular question. And a total score of greater than 50 indicates that the dog has canine cognitive dysfunction. And it was first rolled out as a self-administered questionnaire, so to be filled out online by owners. Okay, so let's score Daisy on the CCDR and see what total number we get with her. So the first question or item: how often does your dog pace, walk in circles, and or wander with no direction or purpose? So she does seem restless at times during the day, but usually that's because she's hoping for a walk, or it's the time of day that she usually gets a walk in. So I don't think that's without purpose. However, she does pace a bit in the evening or at night time, and it's not always clear what she's looking for because there's no food around. She's had her dinner, she's had everything she normally gets. So I'm going to mark that down as once a day, which is a score of 4 for that item. So how often does your dog stare blankly at the walls or floors? So again, she doesn't really do that, but she does stare blankly into space. So I'm going to just say that's probably in the spirit of the question, and that's very frequent. So it's more than once a day. So I'm going to mark that as a 5. How often does your dog get stuck behind objects and is unable to get around? So sometimes she tries to go through the hinge side of the door rather than the open side of the door. It's not every day, but it's probably about once a week on average. So I'm going to mark that down as a 3. How often does your dog fail to recognise familiar people or pets? So that never happens. She's always really excited for us coming home or visitors, like my parents visiting or friends. So that's a 1 because it's a never. How often does your dog walk into walls or doors? So again, I would say that's probably about once a month. So I'm going to mark that as a 2. How often does your dog walk away while or avoid being petted? So never. So that's a 1. And how often does your dog have difficulty finding food dropped on the floor? So she uses her sense of smell for that, really, because her other senses have deteriorated quite a lot. And I often have to, point to it. Now, she won't follow my finger. I have to point with my toe, but that's always been the case. And I have to really exaggerate it. And it does take her a fair bit of time, but she does eventually find it. So I'd say she has difficulty once a day or more. So I'm putting that down as a 5. So you can see with some of those that you would think, well, maybe that's just because you can't see very well, or maybe that's just because you can't hear very well. And that often delays people in thinking that there could be, CCD going on. So the subtotal for this section of questions is 21. And we'll keep going with the next section next. So now we're talking about compared to 6 months ago rather than what's happening right now. So does your dog do something much less, slightly less, the same, slightly more, or much more? And then we have a subtotal. So does your dog pace, walk in circles, and or wander with no direction or purpose? So is that more than 6 months ago? And I would say slightly more, so that's a score of 4. Does she stare blankly at the walls or floor? Again, I'm going to assume staring into space is the same thing, so I'm putting that down as slightly more. Does she urinate or defecate in an area she's previously kept clean? That is increased a lot, so that's a 5 for much more. So things like, it's getting to be quite a hazard in that, there could be a puddle of urine on the ground. If you don't see it, it could be a slip hazard. And there was one time I turned off the alarm in the morning, turned around and stood right in a pile of feces. Thankfully I was wearing shoes, but then I had to clean it up before going out to work. And that's happening a lot more, so we're being a lot more vigilant about it. But that is definitely much more, so that's a 5. Does she have difficulty finding dropped food more than 6 months ago? I'd say yes, much more, so that's also a 5. And does she fail to recognize familiar people or animals more than before? So I would say, well, much less, I think, is the bottom of the scale. Even though it's not less than before, it's about the same, so I'm going to mark that as a 1. And we have a subtotal for those questions then of 19. So switching around again, so compared with 6 months ago, does your dog do something much more, slightly more, the same, slightly less, or much less? So we're flipping the scale around. So the amount of time your dog spends active, is it much more, slightly more, the same, slightly less, or much less? So I would say it's slightly less in Daisy's case, so that earns her a score of 4. And we have a subtotal at that point of 23. And we add the 23 to the 21 from the previous slide, and we get a total score of 44 for her. Now that is under 50, so it seems to indicate that she has normal aging rather than canine cognitive dysfunction. But from what I know of Daisy, I don't really think that's correct. So let's move on and try a different scale next and see if the result for her is different. Next we'll try the Canine Dementia Scale, or CADAS for short, by Madari et al. In 2015. So it is more modern and developed and validated again, but somewhat more recently. It identifies canine cognitive dysfunction, but also is able to distinguish the severity of the disease. So that's new and different to the CCD-R. And there's more questions, so 17 different questions or items, each rated again 1 to 5, and on spatial orientation, social interactions, sleep-wake cycle, and house soiling. So very similar categories of questions based on the typical clinical signs that a dog with cognitive dysfunction will demonstrate. So here's the scoring. So normal aging is 0 to 7 total points. Mild cognitive impairment is 8 to 23 total points. And moderate cognitive impairment is 24 to 44 points in total. And severe cognitive impairment would require the dog to have earned more than 45 points in total. Right, so let's score Daisy on the CADAS. So this is a bit different because the research paper I took this from had these items in a table and it didn't list them as specific questions, so I've had to interpret them a little bit, and that's why they're not really reading as very good questions, but let's give it a go anyway. So the first question or item, so does she have disorientation in a familiar environment? So it's either never, once or more in the last 6 months, once or more per month, 2 to 4 times per month, several times per week, and then we give the score. So I would say that it's about 2 to 4 times per month. So I'm going to score that as a 4. Does she not recognize familiar people or animals? So that's never. She always recognizes people that she knows. So that's a 0. Does she respond abnormally to familiar objects? So I think, once or more in the last 6 months, she went through a spell in the evening of kind of staring at kind of the sideboard or storage unit that we have in a corner and kind of whining and barking at it, and it wasn't really obvious why she was doing it, and she did that for quite a number of days over a couple of weeks and then completely stopped doing it. So I'm putting that down as once or more in the last 6 months, so that's a score of 2. Aimless wandering during the day, so that would be several times per week, but it's more in the evening again, because in the middle of the day she's kind of expecting a walk, so her wandering around, that would be kind of her waiting for it. So that's a score of 5. Does she have a reduced ability to perform previously learned tasks? And I think there's some I don't ask her to do. I don't ask her to do a sit or a lie down because of her osteoarthritis now. But she can follow my hand, so she can't hear me too well. But if I make like a beckoning gesture, so you can see that, in a very exaggerated way, which means here Daisy, she will still follow that, and she can still target. So I would say she doesn't have a reduced ability for that, so that's a 0. Are there changes in social interaction with people and or other dogs? And I would say definitely yes. I'm going to mark that as a 5, as several times per week. Because she used to be up on my lap on the couch cuddling, and then playing, and really now she spends most of her time sleeping and doesn't really look for attention, doesn't seek it out much of the time. Originally I would have put that down to maybe her having osteoarthritis and finding it hard to get up on the couch, but even when I pick her up and have her on my lap or beside me, she enjoys a little pat, but she does then want to get back down again quite quickly. So she is very rare that she would actually come looking for attention from us now, whatever about saying hello to visitors who come to the house. So that is definitely a change. And following on from that, are there changes in her individual behaviour, such as exploring or playing? And I'd say definitely yes, that she's no longer really interested in playing with her toys, like tug toys or squeakers. Now, she can't hear squeaker anymore, I don't think, and her mouth might be a little bit tender. There may be some dental disease there, but given her age at the moment, we're not willing to risk the anaesthetic, so there could be confounding factors with that. But it's definitely changed a lot, so I'm putting that down as a 5, so several times per week. Response to commands, so I put commands down there. We prefer to call them cues because the animal has, to ask the animal or request, because they have a choice in whether they wish to do the behaviour or not. And we don't force them to do that. And command has that sort of connotation, but this is what's written in the research paper. So cues, response to training cues, and ability to learn new training task. I'm not really sure. I haven't tried that recently, but I'm going to put that down as a never, because her training is still intact at the moment, and she does still enjoy training. So that's a 0. Is she irritable? So no, thankfully. So that's a 0. And is she showing aggression? So definitely not. I'm really happy about that. So that's 0. And that brings us to a subtotal for this part of the CADE score of 21. Right, let's score on the rest of the CADE scale. So this is part 2. So the question is, and it's the same sort of scale, 0 to 5. Does she wander or vocalize at night? So never. So that's a 0. Has she switched from insomnia to hypersomnia? Now I had to look up hypersomnia because I wasn't sure what it was, but that's going from not being able to sleep to sleeping more. She definitely is sleeping a lot more every day. So that's a 5, I think. Does she eliminate at home at random locations? So yes, several times per week. She'll now go in front of the sitting room door, under the kitchen table, in the sunroom that we have, and lots of other places she wouldn't have gone in before. Does she eliminate in her kennel or sleeping area? No, she does not, so that's a 0. Are there changes in signalization for elimination? So does she ask to go to the toilet? And before she used to, dance towards us and look away and go to the back door. And if we haven't got the message, she would have barked at us and we would have known that she wanted to go out to the toilet. Now, even if we're in the same room as her, she doesn't do that. She may just go with no warning. So that is definitely changed, and that's a problem frequently. So I'm going to put that down as several times a week, or a score of 5. Does she eliminate indoors after a recent walk outside? Yes, so several times per week, so that's a 5. And does she eliminate at uncommon locations? So it says grass or concrete, and I wasn't really sure what to make of this, because to me, going on the grass or the concrete while out on a walk or in the garden, that's not unusual. So I've put that down as a never, but she does do it, but I don't think it's unusual, and it's not a change in behaviour. So that's going down as a 0. So the subtotal for this section is 20, and we add it to the 21 from the previous slide. That gives her an overall total or score of 41, which for the Cadays puts her into the moderately affected category, which is much more in keeping of what I would have thought given my day-to-day interactions with Daisy and my observation of her behaviour while I've been living with her. So from doing the different scales and my experiences of that, this is what my thoughts are. From a personal perspective, it's confusing that the CCD-OR scale indicated that Daisy does not have CCD, that she has normal aging-related changes in behaviour, while the Cadays indicated that she has moderate and actually nearly severe CCD. My own impression from day-to-day life and interactions with Daisy is that the Cadays result is the one that's correct. Perhaps the CCD-OR is better identifying severe cases but misses milder ones. And the Caday scale does contain more questions, and overall more questions on house soiling and broader questions on behavioural changes. And Daisy definitely has a lot of issues in the house soiling category, so that might be why that the Cadays picked it up better than the CCD-OR as well. Strangely enough, numerically her results in each were actually very similar, going from I think it was a 44 and then I think it was a 41, so that they were very similar, but the results were completely different. From a professional perspective, neither scale took long to complete, but the CCD-OR was easier to use than the Cadays because it included specific question wordings. However, both include questions or items that are subjective and open to interpretation, so for some of those items I needed to kind of think whether something was going to be in the spirit of the question or not, and make a judgment call on it. And both are also subject to recall bias because they're asking an owner to try and remember what the dog has been doing over the last few weeks or months, or especially the CCD, or has there been a change from 6 months ago, and the owner may forget things. So that's the recall bias, not being able to remember things properly. If I could choose only one to use, I would probably select the Cadays, although I would need to create my own questionnaire from the table in the research paper. But I would choose it basically because I think it is more accurate, and it's helpful that it can distinguish between different levels of severity. Overall, we need to start having conversations with our clients about CCD, especially the clients and owners of older dogs, and how it is different from normal aging. If you're suspicious that a dog has it, it may be useful to use a scale to assess him or her. And I know we all have enough to do every day in veterinary practice, and adding another job in isn't ideal, but to save time, the client could fill it out in the waiting room and it serve as a talking point during a consultation, or it could be administered by the veterinary nurse in a nursing consult, and his or her time could be valued by having a charge for the nursing consult as well. Here are the references I used in this video. I've included links to them in case you would like to check them out. I'm not sure if they are all open access or not, so there may be a paywall for some of them. As Daisy probably does have CCD, I would like to explore a practical test to double check it, and then treatment options. So stay tuned for more videos, and if you liked this video, please hit like and subscribe, and I will talk to you again soon. Bye!